Itamapako is an area near Ijebu-Ode town in Ogun State of Nigeria. It covers several villages, including Iloti, Abidagba, and Iloti, in the middle of which Abidagba Health Centre is located. The people in these rural communities live mainly of subsistence farming, especially cassava production. The work often involves all the members of the family. Life for women is often difficult as they have to combine the care of the children and the home with farming and other activities like fetching water and firewood, and the different tasks associated with the processing of cassava. In the community, many have recourse to the traditional healer for the cure of ailments and for protection against evil spiritual forces. The traditional healer, who can be called Babalawo or herbalist, uses plant, animal and mineral substances, as well as other methods based on social, cultural and religious practices to solve the problems at hand. The traditional healers often act as an intermediary between the visible and invisible worlds, between the living and the dead or ancestors, sometimes to determine which spirits are at work and how to bring the sick person back into harmony with the ancestors. In this social context, Abidagba Health Centre began in the late 1980s.
Abidagba Health Centre is a primary healthcare institution that is established by the Education Corporation Society Women's Board to take care of the health needs of the inhabitants of Iloti and surrounding villages.
I started working at Abidagba Health Centre in 1991. By then we were using one room in the main house. But by 1996, we moved to the main site of Abidagba Health Centre.
I work with Eucharistic Heart of Jesus Sisters, and I come in contact with Abidagba Health Centre in 1996. Where they come to treat the patients in Eucharistic Heart Maternity and carry out some laboratory tests with them. Those who are seriously sick, we called on Auntie Christy to come, and she will take them to Epe General Hospital. She will carry out all the necessary tests needed. Then we had an elderly man who was seriously ill, and he demanded that Auntie Christy should come and give him injection. When she came, she said no, that the case is not on injection alone, but an operation. Baba wanted the operation, but the children, the relations said no. They later took Baba back home. And later, we learned that the Baba passed away. However, most of the patients were cooperative after Baba's death, knowing that Abidagba Health Centre was helpful to them.
Many times working with the patients here, you find that for every little thing you do, they are very grateful. any little improvement, they tend to show their gratitude in a way that many times amazes me. For example, here we don't charge so much for the medications they receive. And sometimes you find the patient, after getting well, will come with some gift in kind. And I think that this place has grown because of the appreciation of the people, especially narrating their experiences to their neighbors or people from other villages. And we have seen an increase in the number of patients that have been using this place.
The major problems in the beginning were woods that were infiltrated from the farms. So many women have abscess of the breast. So we realized that we needed to start health classes. And also because the children who are malnutrition, we needed to give classes on winning diet. So we started going for home visits to different villages. Odede, Emwe, Iwaya, Irawo, Odonoko, Odwarawa, Oderewu, and many others. But gradually we realized that the cases were getting less. For instance, the malnutrition have reduced a lot because we usually prepare a pap that is enriched with soya bean. And we also encourage the women to put eggs, which you usually do, give demonstration class so that they know how to go about it. We also give a demonstration on the hydration drinks because of many children get diarrhea. So when we started giving the classes, we got very encouraged because we saw good results. The abscesses were reduced, and then the woods were also reduced, people suffering from woods, and then there were less children suffering from malnutrition.
One of the striking things about the patients when I first saw them was the fact that their problems many times were not complicated illnesses. They were quite simple, and many of them actually could be solved by this health center.
Abidagba Health Centre enjoys a well-equipped and functional laboratory, which is the backbone of its operations.
Here in Abidagba Health Centre, we try to do the basics that can enable the doctor and the nurses to take care of their patients. The ones that we cannot do, we refer them outside. This laboratory started in 1998, and since then we've been trying to see how we can also help to create awareness of the laboratory and the health center. Ignorance really is amazing what it does to people. You can imagine that people fall sick, they bleed themselves, or in order to remove what they call the bad blood. And what happens as a result? Anemia. In fact, talking about anemia, there have been many cases of anemia here, which could result from malnutrition, malaria, and other infections. About 7 or 8 years ago, we carried out a research in 2 schools here. The range is from 2 to 11 years. From the analysis we did, we realized that 87.1% of them were anemic. With this, we have been trying also to see how, through the health care and the health classes that we give, to help people to take care of their nutrition.
The maintenance team makes sure that all the facilities and equipment are always clean and in perfect working condition. The center has an owner. Everyone working at Abidagba Health Centre owns it. From the state of the garden to the maintenance of every piece of equipment, the members of the maintenance team try their best to create a perfect working environment, ensuring a good working relationship with the other health center staff in order to achieve the center's objective. At Abidagba Health Centre, health record staff collate, organize, retrieve and archive the record of a patient for the purpose of recording and informing their care. Good record-keeping practices contribute to the high quality of medical record, which play a critical role in the care and treatment of patients and in the practice of medicine. Entries are made at the time of service or soon thereafter to ensure the accuracy and effectiveness of the follow-up medical treatment.
The health center has brought succor to the people living around Abidagba. Places like Iloti, Okeako, Odolewu, we all go there to seek for health salvation. The clinic was established in a very small room at the beginning, but has now become an oak tree. Our people have received good health through this, and instead of spending a lot of money going to all the way to Ijebu-Ode, they now stay back at Abidagba and get what they want. I want to seize this opportunity to thank the dreamer, Bishop Alvarez Portillo, who made it possible for us to have this organization. This organization has tremendously helped my people, even including myself. I want to thank God for giving us Portillo, for doing that great job, for dreaming and making sure that the health center is situated at Abidagba.
I would also end by showing appreciation to all the donors who give things to us in kind, in cash, drugs especially, medical equipment, sometimes even beddings, some good dressing materials. We are very grateful to those donors. Had it not been for their help, we don't know how we'll cope, because we don't actually charge the patients the full fees for their treatment. They only pay a token because many of them cannot afford.